You may be part of this story. In early 2025, 83% of USAID projects were halted, from small projects and fellowships to awards valued at hundreds of millions of dollars. No region, no health area, no organization was spared. I'm Traci Baird, President and CEO of EngenderHealth. At EngenderHealth, we received stop work orders at the end of January for our USAID-funded maternal child health and sexual and reproductive health family planning projects. These projects were creating good in the world. They were building on past investments, and they were driving progress in access to healthcare and stronger health systems. In January 2025, dozens of women in Guinea in West Africa had been identified as needing fistula repair. They were finally going to have surgery to correct damage to their bodies that occurred during previous complicated deliveries. Our project had the hospital, the surgeon, the staff, and caregivers ready to operate on 21 women around the country, and then we opened our email. The stop work order was crystal clear. We had to stop all project activities, including the surgeries, for the women who had already traveled to the hospital to have their repairs. These women had been given hope that their health and dignity would be restored. That hope had been cast aside by people who did not know their names or their needs. Fortunately for these 21 women, we found a solution. We reached out to some of our supporters, and within days, we had raised private funds so that we could go ahead with the surgeries, and our partners in Guinea provided the surgeries independently, totally separate from the USAID project. Rather than being sent home, the surgeries went forward. The women were only sent home when they were healed. This was just one moment in one country as part of one global USAID-funded project. We know that so much more has been lost, and we know that so many, including many of you, have showed up and stepped up to do everything we can to fill in the gaps. In this session, we share stories and reflections about what happened when USAID shut down and how we and you, your colleagues, your neighbors, your governments, your organizations are managing through this difficult time. Let's next hear from Jemal about Ethiopia.
Thank you, Traci. I'm Jemal Kassaw from EngenderHealth in Ethiopia. You know, before the sudden suspension and subsequent termination of the project, EngenderHealth was running a $35 million USAID-funded lowland health activities in Ethiopia's pastoral regions. Although Ethiopia has made greater progress in improving sexual and reproductive health outcomes, the pastoral regions, because of mobility and the lifestyle, nomadic lifestyles of the population, as well as the limited infrastructure and health workforce, and the frequent crises such as outbreaks, flooding, drought, and conflict, has continued to fall behind the national average. This project was saving lives and improving the lives of such underserved and vulnerable communities in the pastoral regions of Ethiopia. Like many USAID projects, our staffs in this project were very talented and dedicated, and unfortunately we have to lay off more than 50% of these staffs, which coupled with the extensive layoff staff that happens across projects supported through USAID has been a major loss for Ethiopian health system. Luckily, the remaining staff are now working in another project and continue to serve their communities. Through our partnership together with Ministry of Health of Ethiopia and partners, we are adapting to this changing landscape and mobilizing domestic resources, strengthening our coordination, and building the resilience needed to sustain health services in Ethiopia. Thank you very much.
Thank you, Jemal. Afolabi, tell us what was happening in Nigeria.
All right, thank you so much, Traci. Afolabi Ahmed is my name, EngenderHealth Nigeria. Yes, of course, Nigeria, being the most populous Black country, was impacted. Nigeria, which is also one of the highest recipients of USAID grant, was definitely impacted with the shutdown. the last mile distribution that ensures that every woman, irrespective of where they are located in country, can access family planning services. This was also disrupted. And facilities were fast running out of commodities, and there were no sufficient quantities of family planning commodities at these facilities for women who goes to the facility to access services. So they had limited option, and the gap also provided for a leeway for fake commodities to begin to trickle into public health facilities. However, we are able to engage with the ministries of health at both the national and at the subnational level for them to come up with commitment and show more political will in allocating more funds to family planning and ensuring that not just allocating more funds on the budget, but also making release of such funds for the procurement of family planning commodities and having them distributed across the health facilities for women to access the services. We have about 7 to 8 states that are committed release of this fund for family planning across the country for the benefit of women who want to access family planning services at the facility and ensuring that no woman is left behind. Thank you.
Thank you, Afolabi. So you can hear from these examples from Ethiopia and Nigeria just how much was lost in the moment. So suddenly, one email stopped so much. Workshops, training, surgeries, services. And we know this is not just in the family planning and reproductive health space, but across so many health areas. I want to now give Shyami a chance to introduce herself and share some reflections on what you've heard here and what you saw when USAID shut down.
Thank you, Tracy. My name is Shyami de Silva, and prior to the shutdown of USAID, I served as director of the Office of Population and Reproductive Health at USAID in Washington. I'm here in a personal capacity to offer some reflections about the stories that we've just heard. So globally, USAID represented about 40% of total global donor resources for family planning, and the impact of those funds kind of on the ground in service delivery sites was achieved in partnership with partners and with implementing partners like EngenderHealth through the kinds of programs that we just heard about in Guinea, Nigeria, and Ethiopia. I think to understand the magnitude of the impact, it's important to quantify the level of funding. Both Ethiopia and Kenya were, according to our classification, among the highest priority countries for family planning assistance. They received between $20 and $30 million a year for the past, over a decade. And we also had designated consistent funding for the kind of fistula services that Tracy discussed. Over many, many years. So about half that funding supported service delivery and health system strengthening, ensuring that commodities were available, for the Nigeria example, and supporting kind of linkages and overall strengthening of health systems. The good news, I think, if there is any, is that the results of those system strengthening efforts over many years can't be wiped out in a moment. But many gaps still exist. So, one of the things that I want to, praise EngenderHealth for is this shared sense of values in terms of trying to extend services to the most marginalized groups. One of the losses that I feel is a global program that we had that didn't have a chance to get started called Access, which really focused on expanding access to family planning for the most marginalized groups through person-centered, rights-based services, and that program had not even started when we were shut down. So that was one of the emails that Tracy was mentioning. So I just want to flag that these longer-term needs around system strengthening and SBC exist, and I want to thank EngenderHealth for the work that they're continuing to do.
Thanks, Shyami. And we know that so many people here at ICFP and in the virtual space and everything else have had these cuts and are compensating as well. So we invite you to share your stories. We're using the hashtag because of USAID, And we hope that you'll share your story there so we can learn from you and we can continue to share both stories of loss and stories of resilience. Thanks very much.